to the Phage Therapy Center in Tbilisi. You see there the sign. It doesn't look like much, but there's people that see quality outside themselves as huge buildings, big cars, big things, and there's those that see quality in simplicity. And the clinic is simple, but the care is top quality. However, it is holistic, and it does mean you have to be willing to also look into yourself and invest time and space in yourself. I'm going to go in now. We send in the analysis because that's the starting point. You go to the website, you make an account, you seek contact, and you send your samples because they do it thoroughly. Your sputum, your faces, and whatever else is needed, your blood. You send it, they investigate it and compare it with millions of other studies. It's totally, utterly scientifically based, but it's pure science, not bought science. It's pure. And they look at all the samples, they compare your intestines and your microbiome with millions of others, and they see exactly where yours is different than the others, or where there is an overgrowth which is causing your illness. I will tell you more about it later, but we first go inside, shall we? Nou, dit is dus het kamertje van de Phage Therapy Center waar mensen eigenlijk komen voor de behandeling. Het is een holistische behandeling. En op dit kamertje word je aan het infuus gelegd met vloeistoffen om je immuunsysteem weer te boosten. Dus je wordt zowel behandeld als je systeem versterkt. En dat duurt ongeveer 20 minuten. Maar het is pijnloos en goede behandeling. En dat was het. Ik ga nu de gang in en ik ga even met de arts spreken over de resultaten.
We're here with Dr. Eliava Insitute, a microbiologist with an experience for like a decade with bacteriophages, and we're here to ask her some questions, and she's willing to answer some questions for us. Dr. Eliava Insitute, how long have phages been into practice, and how long have you been practicing with phages? Can you tell us a little bit?
The 2023, it was 100 years of Eliava Insitute of Bacteriophage, Virology and Microbiology. I work at Eliava Insitute 55 years and been head of the biggest lab, Phage Morphology and Biology. I am right now retired and work in the Phage Therapy Center. This is the Georgian American Phage Therapy Center, and our patient is of course Georgian patients and foreign patients too. Georgian patients, everybody knows in Georgia what is the phages, how it's used. Phage don't have any side effect to compare the antibiotic and phages. Antibiotic make very good success from the beginning, but uncontrolled the antibiotics. The people start to use without any consultation with the doctors, and it's become more and more resistant. And right now, only one alternative is bacteriophages. Antibiotic has a lot of side effects if we compare the antibiotic therapy and phage therapy. But phages is very specific. You need to be sure before you start treatment which phages you need to work. That's why we all the time ask the patients to send us some samples and then isolate the pathogen and then start the work. We check from the beginning when we receive the material for the investigation, we isolate the pathogen, check commercial phages which already is we sell in the pharmacy. If it's work, of course we can invite our patient and start treatment. But if it's resistant, we check our phage bank, which is a lot. from the beginning to 1933, start Eliava Insitute, small lab. After it's become the big, the largest institute, George Eliava and Felix Derel decided together to make the World Center in Georgia. It was 100 years ago, during this time we collect all the phages, and we have a huge bank.
That's what I thought. You must have a huge data bank of information.
Yes, and we can prepare for the patient individual. We call the custom phages, but it's take time. It's minimum, it's necessary 8 weeks, 2 months. And then after we start the treatment, usually our patients are chronic patients because they all the time start with the antibiotics, usually different kinds of some medication, and after finally when nothing is helped, they become our patient.
So it's actually what you're saying, because we often hear, well, when nothing helps anymore, we send them to phage therapy. Actually, you're saying we should start much earlier so the patients don't become so bad.
When it's acute, we use the one course is enough, but the chronic patient, it's necessary to come maybe 1, 2, 3 times sometimes, because after the treatment some latent infections stay somewhere, and when the patient has some discomfort, when the immunity is laid down after some virus infection, or patient has some cold or something like that, the immunity is down, and these latent infections start immediately grow. So the chronic patient needs several courses. So that's why the chronic patient needs several courses. It's of course usually during several years patient has not only one, maybe sometimes several pathogens. All pathogens produce the different kinds of toxins, and we recommend to make the detox. Detox to clean the body.
Right?
This is the holistic, because if patient
how it works?
how it works. Let's see. If patient has a sinus infection, if you treat only sinus infection, against the sinus infection, patient take antibiotics. These antibiotics damage gastrointestinal flora, no normal flora, and patient has a dysbiosis. If you don't treat the dysbiosis, no digesting.
So actually you say the health is damaged here.
It's damaged here, of course, and then that's why we prefer patient come here to have a holistic. But sometimes we send the patient use for the throat or for the sinus. It helps, but it's not holistic treatment.
Because I've seen you have intravenous treatment. Is it what is in it? Like vitamins, minerals?
It's IV vitamins and minerals to clean the body. Yeah.
Because you said something before which is very interesting. I remember when I was a child, they used to do bacteria analysis in Western countries. Now they don't do it anymore. They give you straight away the antibiotics. But what is the danger of that? Because they don't know anymore which are the pathogens.
Antibiotic works perfectly, but a lot of people use themselves without the consultation with the doctor. That's why a lot of antibiotic resistant strains become. Right now, if it's resistant, you take and damage your body. It's not help. It's not kill anymore your pathogen.
And they become stronger.
It becomes more and more resistant.
But can I say something? Even in Western countries now, doctors, they prescribe
right now,
quickly.
Everywhere, a lot of company right now which study phages and start to prepare the phages. If they work together, it will be much better. It's become more earlier and helps people everywhere, not only in Georgia, everywhere. Yeah.
So they should work together. But what I also hear you say is that the analysis of the pathogen is crucial, and
Yes.
it's not happening anymore.
Yeah.
No Western countries. I ask sometimes a patient.
I don't know exactly what happened.
I will tell you a
Western
story about a
countries.
lady. She had
Yeah.
a pen, something removed, part of her colon.
It's better when
And
you
they-
take in, you know which pathogen.
Yes.
Without that, you cannot start treatment with the phages.
So we
because
should go back to that.
Staph phages works against staph. E. coli phages works only E. coli against the E. coli.
Yeah.
If your patient has a staph and give you the E. coli phages, why? It's not help, of course.
What you say makes so much sense. So actually you say study the pathogen, then
Sure.
treat the pathogen
Yes,
as early as
definitely.
possible. If
Yes.
you don't even study the pathogen, what we don't know nothing.
Yeah.
So we go on prescribing, because they even prescribe in the West very easy, prescribing antibiotic because people are sick.
Sure.
They are sick.
Sure.
But they don't study the pathogens anymore. And that's actually, from what I understand, not a good thing, because we might have, like they call superbugs, is that correct?
Sure.
Super pathogens.
Yeah.
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 It's very interesting because we have a lot of chronic sick. Only in the Netherlands, I think 50% of the people, 7 million people, have a chronic illness. And 2/3 of that, 2 or 3 chronic illnesses. So imagine we could actually make a change when they work together with you and your institute.
So our main purpose is to help the patients.
Yes.
You are. You know, you
Yes,
are second time here,
Yes.
and we do everything to help the people, and we will continue, of course, the same way. Because nobody, we don't have any patient who tell they don't like here or they don't help all the time. It's our main direction.
Yes, that's what my cameraman actually, he had a question like, what is the one success story that you could mention without mentioning the patient?
We have a lot of course, the success stories, but we say visually, for example, gastrointestinal or the bronchitis or something like that, the people cannot see. But when we have an unhealable wound, or when we save, for example, food which decide to, in the Western countries, to amputate, and we save these legs, it was, of course, it was everybody can see such story, and then it's, for example, we have one patient who give us the possibility to use his name. Name is Bledsoe, who has some foot problem, and they need to amputate. He come here, and during 1 month he go in his country without, and continue to life with the
That's amazing, isn't it? I mean, I really think it's amazing what you do, and I've seen the results myself, and I would recommend this, and I really hope that doctors there stop saying there is no data. There's plenty of data. There's peer-reviewed analysis.
I will collect for you such cases, and after
Yes, we put it under the document.
Yeah, I will send you the pictures.
Yeah.
I send you some small history about our patients. It will be because a lot of documentary. The first BBC documentary was in, I think, the 1995 or 1994. BBC take this. It's totally in the Eliava Insitute when I worked there.
Yes, I remember that. Yeah. Well, I'm really happy, thank you very much, and I hope you have a lot of students, because I think this is amazing work that we need to continue, because actually you do exactly what we want in the future. You work with nature in such a magnificent way. So thank you so much, Stefan. Thank you very much.
We are so happy to help the people.
Yeah. That's it for today.
Phage, dus het doosje. Heb je deze en je hebt deze voor de longen, voor long-covid. Nou, dat is een hele behandeling, want je begint met Buongiorno water. Dat is water met natuurlijke mineralen erin. En baking soda, wat heel belangrijk is om je ontzuring van je lichaam. Want je lichaam is vaak verzuurd, daar ontstaan ook allerlei problemen door. Dat neem je in. Een half uur later begin je met phage. Dat is dus het inhaleren van de phage. Je maakt ze open, je haalt het dopje eraf. Ze zijn goed gesealed, dus het is heel beschermd en goed onderbouwd. Het is dus echt een medicijn. Daarom is het ook gesealed, zodat je ook weet dat je een medicijn krijgt. Daarna wacht je een tijdje en neem je biflorac, dat is probiotic en prebiotic, voor je darmen ook, voor je lichaam. Dit is voor de phage die je moet innemen. En dan heb je deze die je weer een tijdje daarna inneemt. Het is dus een hele intensieve behandeling. En dit is voor de phage die je neemt in je lichaam. Dan heb je ook nog de phage die je inhaleert. Dan ga je naar deze. Dan heb je een machientje. En dan doe je dit erop zetten. Je doet de vloeistof in het bakje. De phage. Met het klepje erop. En dan inhaleer je dit net zo lang tot de vloeistof op is. En dat inhaleren is vooral voor de bronchiën en de longen. Dus long-covid wordt hier ook behandeld. En het is dus wel een hele procedure. Je bent wel een uur bezig. En je mag dus een uur daarvoor en een uur daarna niet eten. Want de phage moeten echt de ruimte krijgen om hun werk te doen. Het is dus echt heel zorgvuldig. Ja, dat is eigenlijk, daar moet je er wel voor over hebben dit. Maar je wordt er beter van. Je lichaam herstelt zich. Je darmflora wordt weer hersteld. En de goede bacteriën blijven en kunnen zich weer vermenigvuldigen. Maar de slechte bacteriën, daar wordt een deel van gedood door de phage. De phage groeit dus echt één particuliere bacterie of pathogen uit. En dat is vaak de pathogen die jou ziek maakt. En dit wordt echt zorgvuldig, volledig wetenschappelijk onderbouwd. Dus je weet dat je een goede hand.
Now, there we are at the end of the journey to natural healing based on thorough scientific research. Dr. Eliava Insitute has been working in this field for like donkey's years. And her colleague also, because she's teaching as a professor as well, she's teaching this as a profession because she doesn't want it to get lost. And her colleague is studying this for 23 years and told us how even children, when they have an infected eye, and they can be treated and they can be cured definitely, because this cures the foundation basically. I mean, they look at the pathogens and they cure. They deal with the pathogen. A phage is something that is designed to attack one type of pathogen or bacteria, and that's the one usually that is causing you problems, and it will reduce that one without attacking the others. And this clinic in Tbilisi, Georgia is affiliated with a clinic in California. I'm just going to explain a little bit how this works. This is just an example. It's an encophage. It's what you take orally. Now what you do, you drink bicarbonate, because phages don't work in an acid environment. And half an hour later you take the phages orally. And then you can take biflorac. It is probiotico and prebiotico. It's very important. You take a tablet. And then after, depending on how much treatment you need, you do the phages, which are also these two, and you put it in a nebulizer and you inhale it. And you really, in between, you must take like half an hour or an hour. You really must take your time, and it's really investing in yourself. After that, you take a tablet which is based upon artichokes, which helps you to digest your food, because a lot of people don't digest their food. That's why they get liver problems and all kinds of other problems. This is basically the way it works, so you must be willing to invest. But this was really our journey into a natural healing, which has been like 100 years old. And I know that in the beginning in the Western countries, because I've asked many nurses, they used it until the 60s. Then antibiotic came, which did a great job, but it damaged also all the good bacteria. And those who know or those who don't know, we live in our body, live thousands of bacteria. Actually, if they wouldn't live in us, we would die. We need them. But what we don't need is a disbalance. And when we get pathogens and they grow and they're not treated, we get very, very sick. That's what Dr. Samvir meant. Some people get chronic ill, and it's best to be there ahead of time. So I recommend you start early, investigate the clinic, find out what you need, and see if there's a way through crowdfunding or any other way that you can go there and treat yourself. And hopefully in the future they will start to work with these wonderful clinics and this wonderful way of scientific and medical-based and evidence-based healing. Thank you very much, and enjoy your journey.